I just had some tea, and I was just wondering if you really have that much fun that I have. Just going into the 20 guna. The thing is, always you have to keep in mind that you can't know everything from the beginning, and you can't sometimes understand everything from the beginning, because normally in India it is a study of 10-15 years, and then you just start actually practicing under supervision. We are trying to give you basic overview how it can work the best, but we will also teach you what can be done with simpler methods. But the more you practice, the more you will be successful in understanding, that's what she meant. Now I can see this happening. Always remember that Ayurveda is the science of empiric wisdom. That means it is a science that comes from observation. It comes from transmitting knowledge like we do that now in one-to-one sessions, or that you sit with a teacher where you can always ask questions. But the main thing is observation of nature. This is your main learning. And when we always say, so our teaching now is a sun teaching, then the sweetness comes with the moon phase. It comes in the phases where you go into your observation and you learn from your own observation. So what we're giving to you is a frame where you can place all the little gems inside that come from this course, that come from the lectures that we have been providing you, that come from any other source that you have been previously learning or you're gonna learn somewhere. So, but still just like this little box, and you put all your little gems inside, and then suddenly it's just like, wow, this is suddenly a picture. These are not bits anymore. But as much as you have a garden in the springtime, in the cold countries, I have to add, not in the tropics, but in the cold countries, and you see the soil, just kind of recovering from the winter, from cold and the dryness, and you just put some seeds in the soil. So what does it look like after you did that? Same. It just looks exactly the same. And then, ooh, the sun is rising. The warmth is increasing. Oh, sun is going down a bit, but rain is coming. And then the first sprout is coming. The first 2 leaves are popping out of the soil. And you look at the picture now and it's a bit like, oh, there's still the square of naked soil and the occasional shoot here and there. And then we kind of like winding the picture forward to the early summer. And suddenly you see, oh my God, there are red tulips and they are counteracted by white narcissus and purple hyacinth. And there's a little bit of grass sprouting around, and you can see the first of the poppies coming up. And then probably you'll have maybe something edible planted by the side that is now also coming up from the soil. And then you see a beautiful picture of rich colors, of so many shades of green and red and yellow, and it's just beautiful. And this is the way you learn. So we see you as this really ready, fertile soil that is ready to receive in order to then give. But we're now just kind of digging in the seeds and the bulbs in order to wait then for your experience of the sun and the moon and the rain and the wind, in order to create your own and unique picture where you put your emphasis on it. Every one of you is very, very different with very, very different life experiences. So some of you might say, oh, I'm so interested and I will only coach according to the ahara. I will only coach according to anything that is just related to nutrition. And the other person says, this is really boring. People think they can heal anything with nutrition. I'm so much more interested in healing with the breath, because opposed to the nutrition, which we do like 3 to 5 times a day, we breathe up to 20,000 times a day. Isn't that maybe more efficient? Yes, but maybe not, because for the person who is transmitting the wisdom, then what the person is more connected to, she will be more likely find the audience and can be convincible, opposed to somebody who is maybe an excellent breather but really sloppy with the nutrition. And then somebody comes and definitely needs nutrition because it's malnourished, and then the person says, it's not important, let's breathe. No, that's not how it works. You know, you have to find your dominance, and then you will be a very good counselor on that. But you should also have the other knowledge, and you have to be connected in a nice network where then you can also refer the people and say, you know, I will do the breathing because it's so important to get your stress level down. But at the same time, I think you have a nutrition problem, and I can advise you to a beautiful friend, and she's much better in that than I am. And we are working in a team in order to improve our knowledge, all of our knowledge. Yeah. So never be shy to admit, oh, I don't know. It's not a problem not to know. You can't know everything. It is impossible. But you have to know who knows and, or where to find the answer. Yeah. So be less annoyed by yourself. If you don't get the whole story immediately, be more patient, and maybe look also in that kind of pitta attitude where you become impatient, or look at your attitude that you say, oh, I have problems in learning. Maybe that's a kapha situation. Maybe you can change there, but also make an inquiry in your own kapha situation, why the learning is so tiring. But then you also realize, oops, but compared to my other students, mates, I took longer to learn. I can remember better. So that's a kapha. But how about the person who grasps everything in the first sentence and just, you know, constantly nodding their head? Whenever I say something, nodding their head. And what is happening in the end? Miss Kappa, I have a problem. Can I have your papers because I forgot to make notes? Yeah. And what's about the pitta? Very engaged, very here and there, and just, you know, hitting the point, and just running it all a bit over and burning it down and say, oh no, I need to do more, I need to do more. No, the pitta always also needs the cooling, the sweetness, and the time to reflect. Because the minute you start getting into medicine with the emphasis of aggression, with the emphasis on dominance, this is not a connection for a healing process. You have to dominate in a gentle way the patient. You know, you have to make really clear that you are the person who bears the knowledge and who is reflecting the problems. But you should never be aggressively dominating the patient by telling them what to do, and then also being annoyed if they don't do it. That's why, coming to the next point, why we should not treat our family. Because what happens? I don't have to explain. You're getting into a pitta situation. You want to succeed. You want to convince. Don't do that. Just let it happen. Just give directions, but stop. I want to. Good. Okay, we're coming to the next, which is a very nice one. I love this couple. It is the Snigdha and Ruksha couple. So Snigdha quality is something I really like. I just like the word. A Snigdha, you think a little bit of a snail, right? It also has a name, it sounds a little bit like a snail. It is moist, it is a bit oily or fatty, but it has this kind of like sneak that quality, right? It is definitely a part of the Mahabhuta of Jala, which is the Mahabhuta of water. And of course, it is part of the dosha of Kapha, and it is definitely an antidote to Vata, right? So Snigdha promotes the moisturizing of tissue, which is very, very important. When it comes, for instance, to ladies' changes, then we find the more the woman is aging, we find a tendency to ruksha, to dryness. The snigdha is decaying, and we could explain that now in the Western term saying there's a decrease of estrogen, right? So the vaginal tissue gets dry, and together with the vaginal tissue dryness, we also experience an onset of more bladder infections, because also the urethra, the little tube of the bladder, and the bladder tissue itself, that's also mucous tissue, also gets more dry. The intestine gets more dry, the lips get more dry, the inner mouth gets more dry. That means if something is not snigdha, it becomes a little bit more porous. The opposite would be, of course, if there is too much, there is an accumulation of fatty, oily, congested stuff. So that would be like really fatty skin, sticky sweat. What else can be just like sticky and nasty? It promotes definitely also ama, because also ama has the tendency of snigdha. It is gluey. Yeah. So when we look again at the lady in the menopause, then there's one symptom which is called the frozen shoulders syndrome, which is connected to menopause. And why is that? It is because also the cartilage, the stuff that is surrounding your bones, is also snigdha. So all the fluids you have in your knee, all the fluids you have in any of your joints, which are not made with blood. It's very important, because inside a joint, there should never be blood. There should be just that oily, gluey cartilage liquid. Yeah. So this is a liquid that also is decreased when either there is too much ruksha in the lifestyle or in the nutrition, or if there's a decrease of snigdha because of a certain hormonal changes, age problems, etc. So if we increase snigdha with certain dravyas, with certain herbs, we can just help the frozen shoulder syndrome, we can help vaginal dryness, but we can also help for women who want to conceive, for instance, to increase the uterus lining. And there's one herb, one dravya, it's called Chatavari, also translation, she who can have the 100 men, which is then an aphrodisiac, but also increases the thickness of this snigdha, of the gliding and connecting qualities inside the body. You can't say it different. So snigdha, you also need for your eyes, to keep them moist. You don't want them watery and running. You want them moist, correct? You want your teeth moist. You don't want them dry. You want also your skin to have a certain type of snigdha so that it feels comfortable. And very easy, very clearly that if your skin is ruksha, if it is dry, it feels really uncomfortable. It feels like it's gonna stretch and break. So when we look at the ruksha, the dryness, we say this is often very important for people suffering from an increased kapha, because in increased kapha, there's a lot of liquid. For instance, there's a swelling above the eyes, there's a swelling underneath the eyes, there's a swelling of the ankle bones, there's a swelling on the tissue here. There's sometimes a singular swelling. So ruksha, which is part of air, which is vayu, and part of fire, which is tejas, and it counteracts jala, water, but it's part also of prithvi, of earth or soil. So ruksha is a very complex part within the dosha creation, and it increases vata and it decreases kapha. So it reduces fluid and it dries excess secretion. So if somebody sweats like hell under the arms or on the palms, or again, looking at menopause, you know, sometimes people start sweating too much, then you would give something or give a lifestyle or give a suggestion that is ruksha, or give a dravya that is ruksha. Give something that is drying and doesn't form a paste if it's drying, right? So it increases dryness and roughness, but it also makes people weaker. That is one of the problems when people have a tendency to snack dry things. For instance, again, rice crackers. It's very, very dry. So avoid that. If somebody is cachectic, it is already a reduction of body tissues. Avoid anything that is ruksha. When you look at the ladies again, and there's malnutrition because of constant dieting, and then they come to us and say, I like to have a child, but I can't conceive. So we often find there is a ruksha in the dhatu of the just reception. Yeah, so it's very important. Please look for more snigdha, look for more stabilizing and moisturizing agents, opposed to for anything that is ruksha. And ruksha, just also connected with cold, like what we see in smoothies, is just a really bad choice. Yeah, ruksha, for instance, would be something like a spinach, raw spinach leaf in a blender as a smoothie, and people say, no, that's really liquid. No, it's not liquid. It is for us considered as being very dry. And that's also, if you look at the fibers of the spinach or of salad, you know, they're very long. And so when you have them in a blender and you just chop them finely, they have a tendency to absorb liquids. So if you have anything in your smoothie maker for a little bit longer standing, you suddenly feel it starts clotting. It just gets really a bit more solid. That's because of the fibers that you have been chopping up, because they should be actually chewed and mixed with your saliva like we did in Dravya Guna too. So this is a very, very bad decision. So I think we're getting there. So the next one is called sthira. Sthira is a word that we also know from yoga, where we say the pose has to be sthira. So sthira is something that is solid. It is compact. It is just providing a strength, a baseline. It is clearly a Mahabhuta of earth, of Prithvi, and it's definitely Kapha. So sthira just nourishes and stabilizes the dhatus, the bodily tissues. They shouldn't be too loose. So you sometimes see people where, you know, the body tissue is very loose. This is, for instance, because I'm old. So sthira is reduced. When you see a baby, you can see it is sthira, you know, it is kind of just springy. It's very nice, you know, it's very compact. It supports the lifestyle of the baby. This is now just kind of like supporting the end of a lifestyle here. And the opposite would be chala. So chala is anything that is not stable, it is moving. Yeah. Okay. So chala belongs to the Mahabhuta of air, and it is clearly a Vata dosha. So chala is anything that is stimulating and promoting mobility. Isn't that beautiful? Stira means anything that is decreasing mobility. So, sometimes people have like a cracking joint and everything is a bit too loose. You would just use techniques either from yoga or physiotherapy and also from nutrition to stabilize mentally or to stabilize on your bone structure. It can be very, very important to really stabilize. Somebody who has been running a marathon, does he need something that is more mobilizing? No, they need something now to stabilize. After a disease, we need to stabilize. We don't need to mobilize immediately. First, we need to stabilize. And when it's stable, then we can go into the chala, then we can go into the movement. But don't go into the movement immediately. You would just break anything that is there. So the chala belonging to the vata supports then mobility and also ends constipation. We said vata normally creates constipation, but if there's some quality of chala for the vata of the movement, then it can end constipation. But this is not diarrhea. This is just the end of a constipation. Yeah, so this is a treatment for the vata. So if there's too much of the stira, then this is the source of immobility and stiffness. Clearly, if a person just sits, which is very stira, excellent, but there's less mobility and that will end in stiffness. So nothing comes from just looking into one side of the guna. You always have to, as we said in the beginning, you always have to just add or aim for the opposite in order to create a balance. So if there's too much stira in your diet or also in the herbal quality, not often the case, but then it would block the excretion. It can be important. It can be important to stop stool or sweat. But it can be very harmful if too much stira is applied and urine, sweat, feces, and gas are stopping, because this is, according to Ayurveda, one of the main causes of disease, the natural urges, if they are suppressed. So you can think of stira clearly as somebody who has to sit in an office or who has to sit as a bus driver. When can they just let go of gas? When can they go to the toilet? In the middle of the road. I feel, I've heard from my Ayurveda coach, I shouldn't suppress my urges and I now have to have a shit. This is not happening. So these people and most of the industries, they have to suppress their urination, they have to suppress their defecation. And in our countries, it is very popular to also please suppress your kind of gas trouble. You can't just walk around farting like people normally do that in India, farting and belching. We don't do that, and we have to face a lot of consequences. But luckily enough, Ayurveda has a lot of nice treatments against that, of course. So if chala instead is too much applied, too much movement is applied, too many dravyas, too many medications applied that increase the chala, then we have an increase of tremor, we have an increase of shakiness, we have an increase of spasm, muscle spasm, which when you're in sport, oh God, I got a cramp. So this is, there is too much chala, which without enough serum, and it also promotes mental stress. Yeah. So in case of mental stress, in case of spasm, in case of tremor and anxiety, increase the serum. That's why sometimes yoga pose for the mind that is wandering, for the chitta that is wandering, just really can do wonder. Okay.